Legislator Dolhoff.
I am here. Let's all please stand for the invocation. As we are forced to hold our meeting tonight via a Zoom conference, we nonetheless remain hopeful for a viable vaccine in the near future. In the interim, may we please find the strength, the insight, and the vision to follow the best course of action to keep our county safe in these difficult times. Amen. The 2020 board meetings have been distributed. Are there any amendments anyone would like to offer? If not, they stand approved. Report of the Finance and Rules Committee per Rule 6.
Thank you, Mr. Chairman. The Finance and Rules Committee has met and they recommend to waive rules to act upon late resolutions.
Can I have a motion, please?
Bill.
Bill, second by
I'll second it.
Greg. Any discussion? All in favor?
Aye.
Aye.
Anyone opposed? Motion carries. Privilege of the floor. We have two public hearings tonight. The first being a local law rescinding local law number 6-2020 to override the tax levy limit established by General Municipal Law 3-C, otherwise known as the 2% tax cap for the Lewis County 2021 budget. Second public hearing is proposed Jefferson Lewis County LED lighting upgrade plan pursuant to a New York State county-wide shared services initiative. We'll start with the tax cap. Is there anyone that has any comments on that? If not, we'll move forward to the LED lighting upgrade plan. Anyone wish to comment on that?
Larry, can you hear me now?
We can hear. I can hear you now. Yes.
Awesome. I think we have Cassandra Buell and Mickey Dietrich from the Tug Hill Commission. I know this kind of came in last minute onto the agenda, but basically this is something we're putting together on behalf of the towns. The county is not participating in the LED lighting upgrade, but a bunch of the towns have gotten together and they've got a way that they can save some money. And so we need to submit it through the shared services program as a county so that they can reap the rewards of that program. So if Cassandra or Mickey are on, you guys can comment on that.
I can give a quick overview of what we've been working on over the past few weeks. I believe that I had sent on November 13th on behalf of Ryan just an acknowledgement of a draft intention for us to move forward with submitting a shared services plan this year. Essentially, there were 14 communities. Now it's down to 12 communities in the Lewis County and Jefferson County areas that are participating in the NYPA LED upgrade program. And there's substantial savings there. And through the New York State countywide shared services initiative, there's potential for those communities to receive a match of the savings that they acquire through this program. And that, so say that they save $20,000 on their LED upgrades, they have the ability to get a match from New York State. So it could in turn be $40,000 in the end after all it's said and done. So we're working on behalf of those communities to help them reap those rewards through the shared services agreement. And over the last few weeks, we've also been able to identify some potential savings with IT department shared services. Connor and I had worked on a survey a few weeks ago that we may be able to benefit from as a county and for our community. So we're working on that, and you'll be receiving those updated drafts that I'm working on in the next week or so.
So Cass, do I understand that, what you just said to mean that this would be a 50-50 grant for the towns and villages? That the state would share half of the cost of the upgrade?
Essentially, any savings that we can prove to New York State, they will match. So it's not necessarily a grant that they would get, it's a match to the savings that they have to prove that they were able to obtain through
So
shared
what-
services.
What's the time period involved in proving, what the state's going to provide?
So we have until December 31st of this year to submit our shared services plan. And that essentially opens the door for these municipalities to apply for this match in 2021. The project has to be completed in 2021, and that those savings has to be proved, which essentially the estimates that we are going by were provided by the New York State Power Authority. So we have very hard numbers to go by. So that's something, as long as they fulfill the projects, the LED upgrades, then they should be able to access that match by New York State.
I'm still not clear, so they go through this process and they upgrade to LED. That's going to be a cost. But
Right.
Through
the
where the
NIPA program. So there's the retail cost of upgrading their lights, and then there's the NIPA costs to updating their lights. And the NIPA costs that they get are the savings. That savings in between the retail and the NIPA costs are what they can report as saved project costs.
Got it.
Yep.
And I can add to this, Mickey, that we already submitted for a grant through a shared service grant, and that was awarded to the communities. And so that's going to go towards covering what they call the asset management node, which gives the lighting the capability to add smart city technology to them. So that was actually covered in a separate grant. And then also NIPA is providing a $20,000 grant to each community with no match to go towards smart city technology also. So there's actually already some money already coming in from different grants to the group.
So I assume that the county or Tug Hill Commission is going to help guide the towns and villages through this application process.
Yes. Mm-hmm.
Okay. Anyone else have questions? Anyone have any comments on the 2% tax cap? We'll leave those public hearings open for another 25 minutes, I'm guessing, in case someone wishes to comment at a later time. In the meantime, we'll move forward with presentation of petitions, communications, and notices. Cassandra, please.
Thank you, Mr. Chairman. I don't have anything to report tonight.
Okay. Reports of county officers and departments. Cassandra.
Thank you, Mr. Chairman. Legislators have received copies of the Treasurer's November report, the November Highway and Solid Waste audit reports, as well as the minutes of the November Youth Bureau Advisory Board meeting. That concludes my report.
Thank you. Reports of standing committees. Tom, would you like to start off with finance and rules, please?
Thank you, Mr. Chairman. All I've got this evening is I would like to give the Technology Director, Connor Malosi, this time to give a brief presentation on the phone services bid results.
Thanks, Tom. I'll share my screen. I've got a presentation going on. All right, does everyone see that properly?
Yes.
Great. Well, we've received 4 bids for the phone service RFP that we put out. And I've gone through and looked at mainly for cost. And there are 3 big factors that we have to look at when we are talking about cost for the phone services. We have the PRI, the POTS or the analog lines, and then the internet. So the PRI is just, that's the main circuits for how the phone calls are routed internally. We have 400 plus phone numbers assigned to the county, but we don't necessarily pay for 400 lines worth of service. That's all routed and done internally with, and that's sort of the modern technology for setting up multiple phone lines for a business or for a government agency. POTS are what we have fax lines, and POT just stands for plain old telephone. The POT lines are for fax lines or for elevator emergency phone lines and things of that nature. We do have some other POTS that we need to account for and either get rid of if they're not being used, or decide if we can convert them over to the PRIs. And so that's part of the scope of the work that we want to do here as we switch phone services. And the third was the internet. So when we put out the RFP, these 3 components were key to receive from the bidders. What was going to be the cost for the PRIs, for the POTS, and for the internet. We currently have 2 internet connections. One of them is through Spectrum, and that's sort of what we do most of our stuff on. It's 400 down and 200 upload speed. And we have another Frontier connection that's supposed to be our backup. And it's 20 down, 20 up, which is, we don't even really use it. And that, frankly, with those speeds, it's not really a good backup. So we were asking for a replacement for that backup. So I do have a full cost breakdown. I'm not going to get too much into it, but I've got, a monthly phone cost breakdown versus yearly, and cost estimates versus based on the amount of POTS that we're going to need over time and things of that nature. So there's a lot kind of to process here, and I've got that in separate documentation for you guys. But for now, let me just dive into sort of some of the highlights, just comparing the different proposals, and then I'll kind of lay out my conclusions for you. So just looking at the top level, the proposed year 1 costs versus the current Frontier costs. These are, of course, there are some estimates and some rounding here factored in. But currently we're paying close to $60,000 a year for Frontier, for all of our phone services, for the PRIs, the POTS, and the internet, for what we have now. We received proposals from Advanced 2000, who is they are a vendor based out of Buffalo, New York, and they already do some of the phone maintenance for us. We had received a proposal from Verizon, although they did not provide a cost for the backup internet connection, and they did not provide any cost for the POTS, which we are going to need in the short term, but hopefully over the long run, we can remove many of our POTS. We received a renewed proposal from Frontier, and we received one from West Telecom. So if you're just looking across the board for these costs, year 1 cost here for West Telecom is definitely lower than the rest, around 27,000. Frontier's a bit higher. Verizon is obviously the highest, plus they have about a $10,000 one-time setup cost proposed. So just moving on from there. This is, we proposed a 3-year contract. So I just wanted to lay out the numbers over 3 years based on our estimated need for both the POT lines and the internet. And this is what I was looking at here. So current Frontier costs plus the maintenance is about, just the cost is about 180,000 over 3 years if we were going to continue at the same rate. So the idea was, let's save money, and even if we can enhance our functionality while we're at it, why not? So just looking at bottom lines over 3 years, it looks like West Telecom is much lower than the rest. Advanced 2000 comes in much cheaper than our current as well. And the Frontier, their new proposal was lower than what we're currently paying them, so that was good on their part. Verizon solution was quite expensive compared to the rest. So one other thing to factor in was not all internet providers are the same. So the costs that were associated with internet were actually pretty similar across the board. However, what you get for the money matters. So this is what we're currently getting over here with Frontier and Spectrum. And this is what we're looking at on the right-hand side for the proposals. West Telecom, for about the same price, is able to give us speeds of 500 up and 500 down megabits per second download and upload speeds, whereas Advanced 2000 and Frontier proposed 100 up, 100 down for about the same price. With that, West Telecom's internet blows everybody else out of the water and could become our primary internet source, making Spectrum our backup if we needed to fall back on something, or if we ever had an outage or a hiccup of that nature. And that actually makes Spectrum a viable backup because we already get pretty good speeds from Spectrum. So that would really, our infrastructure would be boosted by going with something like that, as opposed to a 100 solution. And the big difference is Advanced 2000 would be actually purchasing through Frontier. They would be kind of negotiating on our behalf with Frontier, and Frontier is using like cable speeds, whereas West Telecom is using fiber, and they have fiber optic connections to New York City and to Montreal through their infrastructure. So just to kind of talk them through real quick, Advanced 2000, I thought their bid was good, and there were some synergies that could be had by having them be our maintenance provider and our phone service provider. And they were the second cheapest, and so I considered them, and I really was diving into what their proposal included. Verizon didn't really meet the requirements of the RFP. They didn't give us costs for the pot lines, which we did need in the short term at least, and they didn't give us a price for internet. And the thing they did propose was expensive. That said, they were proposing something quite different. They wanted to move us even forward to something that's a little bit more forward thinking, a little bit more futuristic, if you will, which futuristic for us might be modern for some others. And it's their One Talk solution. So it's something that the county might be moving to at sometime in 3 to 5 years from now, but right now we're not ready to make that jump. So that's another reason why we only did a 3-year contract versus a 5-year contract. Was let's start moving us forward and then see where we can go from there. Frontier's proposal was good, and because it would be less headaches to stick with Frontier, I wanted to look at their prices. While they did come in cheaper than their current rates, it just didn't compare to Advanced 2000 rates and West Telecom's rates. And West Telecom was the cheapest, and they're local and Watertown based. So I definitely liked their proposal. For me, West Telecom is a clear winner. It's up to you. I mean, we all have to decide on what the contract's going to be and pass the resolution. But for me, the big highlights are there's zero installation fee. They come in and they do a lot of work free of cost, sort of in good faith that we're going to be paying them for the phone service, and so they're going to come in and help us set us all up. They have the lowest expected ongoing costs. They have exceptional internet, and would most likely become our main source of internet, which is going to help us if we're doing a lot more video calls and things from the county. Having that upload speed especially is going to be key for us to moving forward. It's a local business. They have a good reputation. They work with Samaritan Medical Center. They work with other hospitals and municipalities and organizations around New York. Their service agreement is solid, very fast response times, and they have impressive demonstrable uptimes, meaning they don't go down very often, and if they do, it's very brief. costs include maintenance. So we can, in theory, cut out an additional 18,000 or so from our yearly maintenance for phones by switching to West Telecom. Because we're already paying somebody else for this, we might be able to see cost savings by switching to West Telecom. That's apart from everything that we've talked about already in the RFP. So just including that maintenance, our estimated current phone costs are about 80,000 a year. I think our theoretical cost with West Telecom would be closer to 30 to 40,000 per year. And that would be hopefully actually decreasing over time. It might start closer to 35, but I think it would go down into 25, even 20,000 as we remove more pot lines and convert them and things of that nature. I don't expect that to happen on year one. There's more work to be done on the county's end to make that happen, but I think that they can help us get there. So that concludes what I received for the RFP, and I've demonstrated who I think should be rewarded the contract.
Thank you, Connor. Anyone have questions for Connor?
This is Phil. I just want to thank Connor for taking the initiative to do this. And obviously you've saved us a lot of money. Thanks for all your efforts.
Well, don't thank me yet, Phil, but appreciate it.
Take it when you can get it.
Okay.
Any other comments?
Connor, I think you mentioned this, but you feel comfortable with their customer service compared to the other vendors?
Yeah, absolutely. They've been responsive for other things that we've worked with them for, and even during this whole process, they were very communicative, and they asked the right questions and didn't ask wrong questions, if you will. There were others that asked questions that I didn't think were, I don't know, they weren't what I thought they were going to be for an RFP. So
we called references as well. So that was my concern, being a smaller company than Frontier, would they be able to, keep up with our demands? But the fact that they service Samaritan Medical Center, which is frankly a larger operation than ours, and they were satisfied, made me feel more comfortable.
All right. Thank you very much, Connor. And Mr. Chairman, that's all I have for my committee.
Thanks, Tom. Any other questions for Tom? If not, Jerry, General Services Committee. You're on mute, Jerry.
Yeah, I haven't said anything yet. Thank you, Larry. Appreciate it. I've got two motions. I'll go ahead and do those now. A motion to approve separate bid documents for solid waste facility project and scale house project, as well as authorize solid waste director Kip Turk to send out respective RFPs. So I'm making that one a motion.
Moved by Jerry. Do I have a second?
I'll second it, Tom.
Tom, second by Tom. Discussion. Anyone have any comments, questions? If not, all in favor?
Aye.
Aye.
Opposed? Anyone opposed? Motion carries.
And I have one more motion, Mr. Chairman. A motion to authorize District Attorney Leanne Mosier to backfill a keyboard specialist position due to resignation effective immediately. And I'll make that a motion.
Moved by Jerry. Do I have a second?
I'll second it.
I'm not sure who said
Greg.
that. Greg?
Yep.
Discussion. All in favor?
Aye.
Aye.
Opposed? Anyone opposed?
Mr. Chairman, please note my abstention.
Ian abstains. And the motion carries.
Thank you, Mr. Chairman. That's all I have at this point in time.
Any questions for Jerry? Thank you, Jerry. Dick, Health and Human Services Committee.
Yes, Chairman. First off, I have a motion to authorize Public Health Director Ashley Waite to refill a per diem public health nurse position due to a resignation. This would be budgeted expense and in the budget, and we'd like to do it effective immediately.
Moved by Dick, second by
Tom,
Tom. Any discussion? All in favor?
Aye.
Aye.
Opposed? Anyone opposed? Motion carries.
Okay, you want me to continue?
Yes, please.
Okay. We've got several resolutions in the package, and I'll take questions on any of them now or as they come up when we're approving resolutions. It's probably easier to do it with the numbers as we go through with the resolutions. Okay, if that's okay.
Go ahead, Dick, sorry.
No, that's okay. If that's okay, I will go on with the report from the last hospital board of managers meeting.
Thank you. Please do.
Okay, first up is the employee for the month of October. It's Teresa Allen. She's a physical therapist, and I ask everyone that knows her when you see her, congratulate her on her honor of being employee of the month. We welcome Dr. Meny as our new member to the Board of Managers at the last meeting. Budget news finance update. We had a loss of 405,209 versus a budgeted gain of 200,672 for the month of October. Our year-to-date deficit is 327,200 versus a budgeted surplus of 462,95. So far, November is looking a lot better than October, and with interest-bearing accounts that we have, we still expect to get to a zero budget at that year end. We got a lease agreement with GE for an MRI at a cost of 1.6 million. They agreed to install it and spread the costs over 12 months, equal payments with no interest. So that saves us a fair amount of money in that part of it. We had a COVID-19 update. The action committee has been reconvened and will meet daily. Dr. Harney and his team support the COVID-19 clinic, which is running 3 days per week, 11 to 1 at Maple Ridge. We currently have a limited supply of rapid test kits, which are used for only symptomatic staff, pre-ops, school districts, and BOCES. The day of the meeting, Jerry met with Senator Schumer and asked him to see if we can get access to more of the rapid PCR test kits. If you folks been watching the news briefs, COVID-19 is alive and well in Lewis County. If you do it on a per capita basis, we're in a position that I don't like. We're kind of leading the Tri-County area. So with that note, I would like to ask everyone that's watching the meeting now, talk to your friends and neighbors and try to follow the guidelines that were put out by the CDC. The life you save may be your friend, your neighbor, your parent, or your uncle, or your brother and sister. We did it well early on, and I think we can do it again if we just are a little more cognizant of what we're doing. We have an outbreak in the nursing home, as you're aware of. We've had 5 different on-site inspections for focused infection control surveys, and they have found no deficiencies by New York State in any of their visits. Barring any questions, that concludes my report on that.
Questions for Dick? We have our hospital CEO, Jerry Cater, with us on this Zoom. I don't know if you wanted to any additional comments that you'd like to share with us, Jerry.
Sure. Thank you for that. I would say that as Dick has it reported, we have been spending a lot of time on COVID. The governor offered some guidance on where he would like hospitals to focus. And so we have begun the process of increasing our bed capacity by 50%. which is important. There was a point today where we only had one open bed available in the building, but we have had some discharges this afternoon. We have added 8 beds on the ground floor, which was previously the Adult Day Health Center, and will be 7 beds on the second floor, which is a combination of medical surgical and the ambulatory surgery area. We've seen a modest uptick in community admissions to the hospital for individuals who are COVID positive. We are starting through testing to see the impact of family gatherings at Thanksgiving. On the nursing home front, the news is a little more encouraging. Currently today, we have 19 individuals who are COVID positive, but over the next 2 days, we will, if we continue to make the progress that has been reported to me today, we will transition over today and tomorrow 12 individuals from COVID positive status to recovered status. And within the second floor, we've set up what we're calling a kind of recovery unit. So the individual will go from the COVID defined space to the recovery space. By Monday, if there are no additional COVID positive patients, we will be left with 2 COVID positive individuals on the second floor. So we're really making some headway. The nursing service and infection prevention at the nursing home has really worked hard, and many teams around them. It has not spread to the other units. So we're moving in the right direction. However, it is in our community, and we're going to have to be vigilant through our screening process. Right now, we are not admitting to the nursing home. The only exception is if you were in the nursing home and you had to be transferred to the acute side, then once your acute stay is over, you would come back. And the reason I mention that, our census today at the nursing home is 122. And then the other change since the last time I met with you, we are producing a daily media briefing, which outlines the level of COVID positives, recoveries, patients, residents, staff. So, I'm proud to say that we are right now the most transparent hospital in the North Country region, where we are clearly putting out there what's happening in our organization. That coupled with, I think, the briefings that have come from public health, Lewis County as a whole has been very transparent with community infection and recovery, and unfortunately, some of our neighbors who have passed. So with that, I will answer any questions members of the board might have.
Any questions for Jerry? Thank you, Jerry. Appreciate the update. And also, we'll move on to County Manager report. Ryan, please.
Thank you, Mr. Chairman. Building off what Jerry Kerr was talking about, COVID continues to be the main function of county government right now, and the response to the pandemic is taking up most of not only our administration's time, but a lot of our departments have been at least temporarily converted to assisting public health. Few updates. One is we continue to meet on a bi-weekly basis with schools. We have a WebEx meeting with all the school superintendents that is twice a week. So we have wonderful communication with our schools. We are all on the same page that as a community, it's our goal to make sure schools are open and safe as long as possible. Today and Friday, we spent the meetings talking about how we would prepare for the situation if the region or the county were declared a yellow, orange, or red zone by the governor. In those instances, the schools, in order to stay open, have to meet a certain threshold of testing. They have to test 20% of all faculty and staff faculty, staff, and students within the first 2 weeks in order to stay open, and they have to keep a certain threshold of positivity rate. So what we've done is we're working with the schools. Ashley and Bob McKenzie are working to stockpile all the necessary testing equipment we have. They're working with the hospital, Dr. Harney as well, so that if we do go into that yellow, orange, or red zone, all of the necessary testing supplies are together in one stockpile, labeled and ready to go out to the schools that need to receive them. The second thing is we're working on getting all of the school personnel trained at testing. So they're going to need to learn how to use the antigen card testing system, and they're going to need to learn how to put all that information into the eClair system. So Ashley and again, the team at the hospital are working on training all of the school nurses and any other relevant personnel that the schools may want to get trained so that they can provide testing on site. Obviously, we don't have the capacity to bring all of those student and staff into our testing facilities. They need to have, the capacity to do this testing on their own. So we're working with them to bring them up to capacity so that they're able to do those tests on their own. The second group that we're working with is Fort Drum. Back in the spring, Fort Drum had weekly calls where kind of everybody in the region, Jefferson, Lewis, St. Lawrence County, would make sure that we're coordinating and we're all on the same page in terms of the post response to the pandemic. We stopped those calls into the summer, but we picked them back up. Today we had our first call again. And more good seamless communication with our neighbors in the federal government at the United States Army. The regional calls that Larry and I have been doing for months and months and months now continue. The regional control room is still twice a week. We continue those calls. So, twice a week, we're getting on the phone with all the other leaders in our region, all the way over from Jefferson to Clinton County, the whole North Country. A good opportunity for everybody to understand what's going on in the community. Additional COVID update, we did the COVID-19 town hall event last Tuesday or Wednesday. They're all merging together. I think it was Wednesday. With medical professionals from across the county. I think it was a wonderful event, very well received. Everybody did an awesome job. All of our experts that spoke very clearly, and I think answered a lot of questions and hopefully straightened out some misconceptions. Let's see. Like Jerry said, our transparency, I'm very proud of, what we've put out there. I think we have been very transparent, very clear to the public, what the expectations in Lewis County are. And I want to share one new feature with the board. I'm going to share my screen here. This is the new county, it's our county website, the same one, but you'll notice a few new features on here. One is the map, which we talked about a couple weeks ago. This is now updated on a daily basis, okay? We are going to stop doing our emailed press releases. And the reason we're not going to do those is because this page with the map and the data, you've got the data here that is in, chart form, and then you've got it here in graph form, and then you've got it here in map form. This is going to be updated every day before 5 o'clock. So the media, the public, legislators, anyone in the community who wants information, up-to-date information on cases in Lewis County can come to our website and take a look at it. We don't need to take the time to put that whole press release together every day. All the information is right here and available online. So with that, I will end my report and turn it back over to Larry unless there's any questions.
Just one question, where would the public access those COVID data that you speak of?
LewisCounty.org, and there's a big COVID picture right on the homepage. Click on that and it'll take you right to that page. So LewisCounty.org, and you can't miss it from there.
Thank you.
Brian, Larry, can I ask a question?
Sure.
The folks that don't have the computer connectivity and stuff, how big a population in our county are we missing informing them without doing the daily updates that go in the paper and stuff?
Well, my hope is that the paper would still pick up the daily caseload, as would
Okay.
the rest of everyone. It's just we're not going to send it directly to them. They just can go online and look and say, okay, they had, since yesterday at 5 o'clock, there's been 6 new cases added. You know what I mean?
Okay, yep, that answers it. Thank you.
It's a rolling total,
Yep, very good,
And
thanks.
For the health system, Dick, we are going to continue issuing our press release because we do have families with limited internet access. So for us, it's also a way to communicate with them. So we're going to continue our process.
Okay, thank you to both of you.
Anything else on that? If not, we'll move to the county treasurer report. Eric, please.
Thank you, Chairman. I've sent out in advance our 2-page summary you're familiar with, summarizing our reserve balances on the first page. And then on the second page, a summary of our sales tax activity and the health insurance fund status. Just a couple of very quick notes. Sales tax has not changed since information I sent out to you in early November. We will have payments coming in about a week from now, so I will provide you an update when we receive those payments. So the information you're getting here is no different than what you saw a few weeks ago. And the health insurance fund remains healthy. It's having a good year. I definitely think claims have been down. We talked about that earlier in the year, and we're continuing to see that. Activity, to some extent, probably related to COVID. Normal activity has been decreased from prior years. So that fund is looking good at this time. Starting to move into, year-end procedures and processes and starting to get ready to close the books. So that's kind of a focus for the month of December. And I think that is all I would update you on. If there are any questions, I do the best I can answer those.
Any questions for Eric? Thank you, Eric.
Thank you.
I think we're going to go back to the privilege of the floor. Is there anyone that would like to make a comment on rescinding local law number 6-2020? Is there anyone that would like to offer any additional comments for the proposed Jefferson Lewis County LED lighting upgrade plan? If not, we will close the public hearing for those 2 subjects and move on to the report of the Finance and Rules Committee for Rule 7. Cassandra, please.
Thank you, Mr. Chairman. The Finance and Rules Committee reports that they have examined the claims presented for payment in the total amount of $1,012,806.70 and recommend that they be audited and allowed for the amounts claimed.
I need a motion to accept that.
Make that motion.
Greg, second by
I'll second it, Jerry.
Jerry. Any further discussion? If not, all in favor?
Aye.
Aye.
Opposed? And the motion carries. Okay, resolutions. We're going to do these as a slate. We are pulling out number 311, number 312, number 314. Any other resolutions that anyone would like to be voted on individually? Okay, so need a motion to move the slate of resolutions with those 3 exceptions.
I'll make that motion, Tom.
Moved by
I'll second it.
second by Greg. Any discussion? All in favor?
Aye.
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 Anyone opposed? And the motion carries.
Okay, Mr. Chairman. The first resolution that we're going to do separately is auditing and allowing claims in the amount of $1,012,806.70.
I need a motion.
Make the motion.
Greg, second by,
Dick,
second by Dick. Discussion? Roll call, please.
Legislator Gilbert,
Yes.
Legislator Morahan,
Yes.
Legislator Osborne,
Yes.
Legislator Hathaway,
Yes.
Legislator King,
Yes.
Legislator Burns is excused, Legislator Chartrand,
yes.
Legislator Kalzer,
Yes.
Legislator Dolhoff.
Yes.
Okay. The next resolution is number 312, and it is a resolution adopting and otherwise treating local law number 7-2020.
Moved by
Phil.
Bill, second by
I'll second it, Jerry.
Jerry. Any discussion? Roll call, please, Cassandra.
Legislator King,
Yes.
Legislator Kalzer,
Yes.
Legislator Chartrand,
Yes.
Legislator Burns has been excused, Legislator Hathaway,
Yes.
Legislator Gilbert,
Yes.
Legislator Morahan,
Yes.
Legislator Osborne,
Yes.
and Legislator Dolhoff.
Yes.
Okay. And the last resolution is Resolution 314, and it is resolution appointing Lewis County Legislator to fill District Number 2 vacancy.
Phil.
Moved by Phil,
I'll
Second.
second it.
second by
I'll second it, Larry.
second by Dick. Any discussion? All in favor?
Aye.
Aye.
Anyone opposed?
Welcome
Motion
aboard,
carried.
Lisa.
Yes, I would like to say welcome aboard, Lisa. This is quite a large donation of your time towards community service. From our discussions with you, I think you will make a very good legislator, and looking forward to working with you. And thank you for taking the time and having the interest to take this step.
Yeah, I'm really excited about the opportunity to help out the community.
Do we have any other business? Do we need an executive session for anything, Joan?
No, not tonight. We will perhaps have something set up for in the next week or so on some litigation matter.
Okay. Anyone have anything they need an executive session for?
Nope.
No? I'll accept
Move to
that.
adjourn.
That was Greg, second by
Second, Tom.
second by Tom. All in favor?
Aye.
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 And we are adjourned. Thanks, everyone.
Thank
Have
you.
a good evening.
Yep. Thanks.
Bye, everyone.